I'm the anesthetist on staff, and I will be the doctor putting you to sleep today for your procedure. Okay? So today's the big day, huh? How are you feeling? A bit nervous? Okay. Well, very shortly, I will be giving you something to help you relax, just to take the edge off. I don't want you to be nervous, okay? But before I do that, I just have to review your chart and ask you a few quick questions and check your vital signs, and then we're going to roll you into the operating room and get started on the surgery, okay? All right. Now, I just have to lean over and grab your chart here on the table. I just need to make sure that everything's in order. I need to make sure that you're safe today, okay? I also want to check to make sure that all of your pre-op medication has been given. Everything looks good? Okay, so I just need to verify the spelling of your name on your armband. Can I see your arm? Can you just read out the spelling of your name, please? Yeah? Okay, good. That's correct. I'm just going to compare your armband now to the chart. Okay, it's spelled correct. Good. Alright, so just a few questions that I need to verify before we begin, okay? I just need to make sure. Do you have any allergies? No? Okay. And when was the last time that you had anything to eat or drink? Last night? What time? 9 o'clock. Good. When was the last time you went pee? Half an hour ago? So, about 7:30? Okay. Good. Thank you. Now, it looks like the surgeon had ordered you to take a prophylactic antibiotic 24 hours before the surgery. So that should have been taken last night. Did you take that? Yeah? When exactly was the time? 8 o'clock? Okay, good. And it also looks like the nurse gave you the other pre-op medications that were prescribed for you this morning. Perfect. Okay. Good. Just a few more questions. Have you had any flu-like symptoms over the last 24 to 48 hours? Fever, cough, sore throat, anything like that? You had a bit of a sore throat? Yeah, when did that start? Okay. Well, I'm glad you told me. I'll just have a quick look after while I'm doing your vitals, just to make sure there's no inflammation or infection. Okay. Okay, so do you smoke? No? Do you have sleep apnea that you know of? No. Good. Have you ever had an anesthetic before? You have? Okay, when was that? Last year? Did you or any family member that you know of ever have any adverse reactions to an anesthetic before? No. You just sometimes feel sick. to your stomach? Okay, well, that's good to know. I'll make sure to order some gravel to be given in your IV when you're in the recovery room soon after the procedure. Better to give it sooner than to wait until you actually feel sick to your stomach. Okay. So I've made a note here on your chart. Okay. Do you have any questions at all before I start taking your vitals? Okay. Well, if you think of anything, please, you can ask me or the nurse, and we just don't want you to be nervous, okay? So if you think of anything, just let us know. All right? So I'm just going to begin by taking some of your vitals. Just going to put your chart back. Okay. And before I do, I'm just going to put some gloves on. Okay, I'm going to start by taking your temperature first, okay? I just want to make sure you don't have a fever. Okay, so I'm just going to place this under your tongue. Can you open your mouth? Yep, just open. Just place it under the tongue. I'm just going to hold it there for a few seconds until it beeps. Such a nice day outside. It looks like it's going to be a beautiful sunny day. There it goes. Okay. Alright, looks good. Okay. I'm just going to take your pulse. Can I see your wrist? Alright. And slow and regular. Okay. Now, before I forget, I really should check your throat. I know you were complaining that you had a sore throat a couple days ago. I just want to rule out any infection. And I'm just going to use my pen light here just to have a look at the back of your throat. I'm just going to flash the light. Okay? Alright. Okay, so just hold still and open wide. Just let me have a little look here. Yeah, okay, there's a little bit of redness still, but I don't think it's anything to be too concerned about. It doesn't look too inflamed, it's just a little red, a little irritated. Hold still. Can you just open wide? Just a little more. I just want to have a real good look here. Okay. Yeah, I think it's okay. I think we're fine. Yeah, okay. Yeah, I think it's fine. It doesn't look like an infection. Just a little red, a little irritated, but nothing to be concerned about. Okay, just make a note here that I checked. Okay. Okay, so I'm just going to check your blood pressure now. Okay, I'm going to use this arm over here. So just, if you don't mind, pull up your sleeve. That's good. Okay, just going to wrap it around your arm here. Okay. Perfect. And I'm just going to put my stethoscope in my ears. Okay, perfect. Good. It's all normal. Very good. Okay. Wonderful. I'm just going to jot that down before I forget what I just said. Perfect. Okay. I guess you'll be relieved when this is all done, huh? Yeah. Very soon. And I just want to listen now to your heart. I'm just going to get you to loosen the top of your gown there, just so I can pull it down a bit. That's it. Just going to warm this up. Just going to listen to your heartbeat. Okay. Okay, good. Just hold still, please. Okay. Your heart is nice and strong and regular. Just hold still, please. Very good. Very good. Nice and strong and regular. Perfect heartbeat. Okay. And one more thing, I just need to check and listen to your lungs. Okay? So I'm going to check the front and then the back. Just want to make sure that they're clear. Alright? I'm going to have you take a deep breath in. When I ask you, you're going to hold the breath just for a second and then release the breath out through your mouth. Okay? Good. I'm just going to start over here. Okay. Nice deep breath in. Hold. And exhale. Good. Again. Breathe in. Hold. And exhale out. Good. And over here. Okay. Nice deep breath in. Hold. And out. Okay, good. And I'm just going to go to the side and behind you here. I'm going to lean over. Okay. To the back. Okay, good. Nice deep breath in. Hold. And out. Again. Breathe in. Hold. And out. Good. And one more time. Breathe in. Hold. nice and clear. Well, everything is just perfect as far as your vitals. Okay, so I think that's about it. I'm gonna go page the porter and they'll have you rolled into the operating room and then we'll get started. Okay, I'll see you in a few moments. All right? Okay, see you soon. How you doing? You look a little more at ease. Did they give you that medication to help you relax? Good. Okay, well, we're ready to start. I'm just going to give you a little instruction now, and then we'll begin. I'm going to be walking behind you while I administer the medication. But before I do, I just wanted to show you one thing. Are you claustrophobic? No? Okay, good. Because I will be administering your medication through a mask. Okay, and I'll just show you the mask. So, as you can see, this is where the tube will be attached, and when I administer the medication, it'll go through the tube into the mask, and then you will be breathing it in. And as soon as you take a few breaths, it won't be long before you fall asleep, okay? Just let me show you the mask a little closer. So this is the way the mask looks, and I want to show you this here. It's kind of interesting. It's a bit of padding that will seal your face with the mask so that the medication won't leak out, and it's also a lot more comfortable. Okay, so as I place this over your face and your nose, it will be very gentle. Okay, so that's what I'm going to do. So I'm going to move behind you now and we'll begin. Do you have any questions? No? Okay. I'm just going to prepare the medication. Okay.
this beautiful beach. 9. Feel the sand beneath your feet. 8. Gentle waves rolling in and rolling out. 7. Feeling so peaceful, so relaxed here. 6. Gentle sea breeze. 5. Soothing warmth from the sun. 4. Getting sleepier and sleepier. 3. Beginning to drift. 2. Drifting deeper and deeper. 1. Until you drift off into a peaceful, restful sleep.
It's Dr. Sleep. Are you waking up? Hello. Hey there. Hi, there you are. How are you? No, the surgery's already been done. You're now in the recovery room. Yeah. How you feeling? Yeah, you're very sleepy. That's quite normal. All you have to do now is just rest and sleep off the anesthetic. Okay? Yeah. So the nurses are just going to monitor your vital signs for a little while longer, and then eventually they're going to transfer you up to the ward. Okay? And the surgeon will be up there to just talk a little bit about the surgery and how it went. Oh, no, don't worry. Don't worry. From my understanding, everything went well. Okay? Please don't worry. Yeah, everything went well. It's all done. It's all over with now. All you have to do now is just rest and get better, okay? That's all you have to do. You don't have to worry. How's your stomach? Good. I did give you the gravel. Yeah, they just gave you the dose about half an hour ago, and I'm glad it's working. Okay, Good. Well, my job is done. So all you have to do now is rest and get better. And I wish you a very speedy recovery and all the very best. You've been a wonderful patient. It's been a pleasure meeting you as well. Please take good care, okay? Take care. Bye-bye.